Okay, good morning. Today's lesson will be on suctioning. Baycare has two suction kits. One looks like this, and all it has is the little box with the gloves and the catheter. The other one looks like this, which comes with a little napkin that you put on the patient, and it also has a bottle of water. So when you suction, the purpose is to keep a patent airway and possibly to use a Lucan's trap to collect the specimen so we can figure out what microorganisms causing the pneumonia or infection, and to assist the physician in identifying a more specific antibiotic. It's to eliminate excessive secretions, i.e. we want to clear the obstructed airway, and we want to assist patients who have the inability to cough. This may be a physical impairment to the diaphragm, or it may be a neurological disease. Hazards include trauma, which is the most common. Sometimes this is due to new staff that are new grads that have inexperienced suctioning airways, and they do it too vigorously. We see this in long-term facilities all the time among both nursing and respiratory personnel who haven't done it that much. Cross-contamination, i.e. Suctioning one patient and improper hand hygiene before going to another patient. I've seen this recently in an LTAC. Two different hallways the patients were. And so that can be a problem, because if you have a small ICU, which I have seen in the past in a hospital, that if a third of the ICU has the same microorganism contamination, the state will shut down the facility. So this is an important issue even before COVID-19. Hypoxia, one of the situations that occurs that when you're suctioning the airway, not only are you suctioning your secretions, but you're also vacuuming out the oxygen. And this creates a state of hypoxia. And so you can get, the patient can display tachycardia or different arrhythmias. I've seen this twice in clinicals, once with Irwin and once with HCC down at TGH in the open heart unit. I've seen two of them code from suctioning. And what had happened is, with not only their fragile heart condition, they also had COPD, so they were 50-50 clubbers that when we suctioned the secretions, we suctioned the oxygen as well. Alright. You open the kit from the corner, and when you lift out your gloves, you want to lift them by this part right here, not contaminating the part that will touch the patient, and you slide the glove on by pulling it. Now before you put your gloves on, you want to make sure your vacuum's at the proper level. Then you pull out your little box here, and you just pour your water in. And then the way I do it, I take my clean hand and I grab the white and I pull it straight up. Then I'm right-handed, so I take this part and just wrap it. And then you can just connect to your hose like this. Now for nasal tracheal suctioning, you would take the front part of the catheter, this part right here, and lube it up with KY to help lubricate the catheter, so as you go down the nair, you cause less trauma. The pressures you want on your vacuum head is 100 to 120 for adults. And let's see. Now, on a vented patient, you have a closed system with the Ballard, which is the company. And either way, when you're down in the airway, you don't want to be down more than 10 seconds. You can use saline to dilute. Always clear your catheter in your water afterwards. You always want your tubing clear. Tubing clear is actually can be a life-saving procedure. More than once over the 25 years I've been practicing respiratory therapy medicine, patients get plugs, and you want that vacuum ready at a moment's notice. Here's a picture of the lungs, and what you're doing, you're tapping the coronae and they cough. When you hit the coronae and they cough, you back up some before you suction. Okay? Once you back up, you can apply suction. So let's look at the other kit at the moment. Alright, this is the one that comes in a bigger box. This has a different set of gloves. These are green. Again, when you open it up at the bottom, that one fell out. At the bottom, you would grab, it would probably be easier to just do it this way. You would grab it right here and slide it on. And all you do is just pull them straight on. What's nice about the box is this bottle of water. And you pour half of it in your box to clear your catheter. Those are the two types that bake here. I prefer the cap and glove myself. Some places, some nursing homes will have a different system where you just have the catheter by itself. And you would want to get your sterile gloves. And that pretty much covers suctioning. Have a nice evening or morning. And today's May 4th, so may the force be with you. Take care. Bye.